Hello, folks. Welcome once again. And today we will be talking about how to read the brain CT scan in an easy and digestible format. And now, before starting this lecture, I want to give credits to Dr. Leah Al Hilali, who's a neuroradiologist in the United States of America, for using her images into this presentation. So without further wasting our time, let's jump into it and talk about how can we very simply and easily read the CT of the brain. Remember, CT of the brain is considered to be the bread and butter of neuroradiology. And it's also very important for the physicians to be able to at least pick some of the common conditions on the CT of the brain. Now, most of the times that we do CT of the brain, we either do it when we want to rule out fractures, especially in the pediatric age group when there is trauma, or sometimes we want to rule out different types of hemorrhages inside the brain. So the CT brain is a very good modality if you want to rule out fractures or if you want to rule out intracranial hemorrhages and sometimes infarct as well. Now, if you're talking about or if you're thinking about the intracranial tumors, CT scan can pick them up. Like most of the CTs would pick them up, but still, it's not considered to be the diagnostic modality of choice for picking up the tumors. Usually, MRI is far superior to CT when it comes down to the brain tumors. Anyhow, so focusing back on the CT brain, where the focus would be mainly for this lecture, how to rule out different types of bleeds inside the brain. Now, there is a common proverbial saying, they say blood is thicker than water. And that's quite true, especially in neuroradiology as well. Now, normally, water which has got a specific gravity of 1, that is usually shown up as black image on a CT of the brain. Brain is almost like 70-80% composed of water. So that water is where you will see is like mostly it would like where would you see water? In other words, it will be in the form of CSF. You would see it in the lateral ventricles, in the third ventricle, in the fourth ventricle, and in the areas around the brain, between the meninges. So there you would see them as like black lines, black shades. Blood, an acute bleed would always show up as white dense images on CT scan. So remember, anything apart from bone that can have a tinge of white on the brain, especially when you are doing it in the context that I explained earlier, probably means that it is blood. Sometimes, if it is a little bit old, it might show up as some form of gray, some form like some shade of gray. We call them like isodense shadows, where sometimes it's very difficult to differentiate between blood and the surrounding the brain tissue. But nevertheless, for for clinical purposes, most of the acute conditions, if there is blood seeping into the brain, it would show up as a white dense images. So remember, acute blood would always be brighter than water. So having said that, let's move on. Now we all know that the brain is surrounded by 3 layers, and they are known as meninges. The outer one is known as dura mater. Now, dura mater, just remember, as the name says, dura, it's quite durable. It's a very thick membrane. And remember, the analogy is just like a puffer jacket that you usually wear in winters, especially here in UK. The winters are quite severe and very windy. So most of the people, they wear puffer jacket. It's quite effective, in keeping you warm. So the puffer jacket actually is a thick jacket composed up of like polyester fibers, and like it just hugs you from outside. It doesn't fits within to your curves, but it gives you the overall protection. The same goes for dura mater. Dura mater is a tough membrane which is just surrounding, just like a puffer jacket. It is surrounding the brain. Then beneath that, we have got 2 more layers. One is the arachnoid matter and the pia mater. Now, the pia mater basically is the innermost lining, and it is the one that is basically following the curves of the brain. Like this brain is actually has got a convoluted surface in the form of sulci and gyri. So like wherever the sulci and gyri would go, this innermost layer of pia mater like is just like convoluting on the top of those gyri and sulci. So it is just like the inner, like, the pajamas that you wear, like the tight ones, especially that like fits around your curves and other things. So the same analogy can be applied for brain as well. This PA matter is just like the PJ matter, like the pajamas, like, and it just like hugs the surface of the brain, like throughout all the curves, the sulci and the gyri. So that is the innermost layer. In between the outer tougher dura and the innermost pia, you've got another layer which is known as the arachnoid matter. So remember, from outside to inside, you have got the dura matter, the arachnoid matter, and the pia matter. Now, the dura matter is traversed by blood vessels. There are blood vessels on the inner surface of the cranial vault as well, and these blood vessels are on the surface of meninges, especially the dura mater. So, in case of trauma, these vessels can rupture. They can cause bleed, which we would call as extradural bleed. Extra because it's outside the dura mater, so it's inside, like it's inner. It's within the cranial vault, but it's outside of the dura. So it is on the top of the brain. And this type of bleed is usually caused by trauma, especially when it is associated with skull fractures. So that's one of the reasons why we do CT scan in trauma to the brain. Below that, as I told you, is the arachnoid. So there is a space between dura mater and the arachnoid. That is known as a subdural space. So remember, there is space between the inner most surface of the cranial bone and the dura. That is the extradural surface. There is space between the dura and the arachnoid, which is known as subdural space. Then there is space between the arachnoid and the pia mater, which is known as a subarachnoid space. And inside obviously would become intracranial. So remember, as far as the spaces are concerned, or if I draw over here, so let's say this is the thick skull bone, and this is the topmost dura mater. So between this space, this is the extradural space. Then you've got the second layer, which is the arachnoid, and this space between the dura and the arachnoid, this space is known as subdural space. Then you've got the space between the arachnoid and the pia mater, which is known as the subarachnoid space, and then you've got the intracranial. So remember, a bleed can happen anywhere in these layers. So it can be an extradural, where it is between the bone and the dura mater. It can be subdural when it is between the dura and the arachnoid mater. It could be subarachnoid when it's between the arachnoid mater and the pia mater, and it could be intracranial, obviously, when it is on inside the brain substance. Fine. So how do these bleeds they look on CT brain? Now, subdural. Now the subdural space, as I told you, this is the space between the bone, the inner side of the skull bone, and the dura mater. And dura mater is just like a buffer jacket. So if there is a bleed, which usually happens in gross trauma to the skull, like road traffic accidents, where there's usually accompanied by skull fracture. So usually as the blood vessels, they rupture, they bleed, and they bleed between the brain and the dura mater. So what happened? It would occur like a biconvex, because the blood is accumulated, is a liquid. So the inner layer of the cranial vault is sort of a convexity, and then there is another, like, as the blood is expanding, so it would give you this type of like shape, which is known as a biconvex shape. So if you look at this over here on the left side, you see this is the bone, inner part of the bone, which is the inner part of the cranial vault, and this is, if you see, there's a biconvex white hyper dense intense white signal, which I told you that in most of the cases will signify bleed in case of CT brain. And because it's biconvex, it simply means that it is sitting on the top of the dura. It is between the bone and the dura mater. So the biconvex shape is characteristic of epidural or extradural hemorrhage. So this is always biconvex. Remember that whenever you see a biconvex whitish gray shadow sitting at the periphery of the brain, you can swear on that is an extradural or epidural bleed. Then coming down to the subdural. Now the subdural, because this is between two layers. Now this is not between the bone. This is between two layers of the meninges, the dura and the arachnoid mater, and both are like, curving around the brain. So that would give you a sort of a crescentric. One end is convex, the other end is concave. So a crescentic shape, whitish shadow, and usually it would be on one hemisphere, like left or the right. That simply means that that is a subdural bleed. So remember, the shape of this whitish shadow can tell you about the anatomical position of where the bleed is. So biconvex, extradural, crescentic, subdural. Subarachnoid is a bit tricky because subarachnoid, again, the space between the arachnoid and the pyometer. The pyometer now is convoluted because it's like going wherever the brain sulci and gyri move. So this would be just like, because I mean, if you look at the surface of this gyri and sulci, serpentine, just like a snake, a wiggly jiggly snake. So if you see a shadow, which might be a small one, might be a big one, but if it is like wiggly jiggly, it is in the form of curvy linear whitish shadow. And usually it's a bit hard to pick up, like I would say novices usually find it very hard to pick up subarachnoid hemorrhage. It usually comes with a bit of experience when you've seen a lot of CT scans with these types of bleeds, when you are confident enough to pick it up just by looking at the CT scan. So usually they are small and they would be seen like whitish shadow, like in a curvilinear fashion, and they are usually like trying to infiltrate into the brain sulci and gyri. So it might be into where the fox cerebri is coming, or where the sulci and gyri are coming. So you'll just follow. Normally the sulci and gyri would be blackish because obviously they're surrounded by CSF, and CSF should appear as black. So the sulci and the gyri, the space between them should appear black. But if there is a whitish or gray shadow coming in between, that is most probably a platus subarachnoid bleed. So again, you correlate it clinically. So there's a clinical history of severe onset of unbearable headache, and maybe associated with high blood pressure, or if the patient is anticoagulants. Well, I mean, that clinical picture and what this type of image on a CT scan would fit the bill, and you can say that this is most probably a subarachnoid hemorrhage. So remember, biconvex, extradural, crescentic, subdural, and serpentine, small serpentine here and there, like where it is extending, where you would see normally black shadow. If you're seeing whitish shades going in there, probably that is subarachnoid hemorrhage. Here I would show you different images, and all of these images, I mean, let's start from the top one. Okay, so in the top one, I mean, if you see, there are a few bony shadows, but then you see that there are infiltration of whites like in different spaces. It's probably subarachnoid hemorrhage. Here you can see another area, okay, where it's like infiltrating inside. Normally you shouldn't be seeing some form of gracious. Again, subarachnoid hemorrhage. Here you can see a bit of whitish, extending, where normally you would be seeing some blackish, and that is subarachnoid bleed. Here you can see another from where the whitish shadow is extending into the sulci, subarachnoid bleed. Here you can see a bit of like, asymmetry of shadows white over here, subarachnoid bleed. You can see the same over here, the same over here. Okay, and if we go over here, you can see the same extending into the sulci here, and some here as well. You can see the whitish serpentine like shade. So in all these images, there is one thing common, that normally where you would find a blackish shadow, you are seeing whitish shadows, like serpentine whitish shadows into the sulci, deep into the sulci, or close to the surface, or deep inside. So if you are finding whitish over there, that is subarachnoid hemorrhage. Like for example, if you see here is a blackish shadow. Why this is black? Because there is cerebrospinal fluid, but here it is white. So it simply means that there's been bleed on this side, and this bleed is between the arachnoid and the pyometer, because the pyometer is like convoluted on the surface of the brain. So again, like the blood is dipping into those surfaces, and that gives you this type of curvilinear appearance. So that is subarachnoid hemorrhage. Now, the question is, why these types of intracranial bleeds, whether they are extradural, whether they are subdural, whether they are subarachnoid, intracranial, why that is a problem? I mean, normally these bleeds are not like that sort of extensive bleeds where somebody would bleed to death. Like, if there's an open wound hitting the large artery, somebody can simply die because of accentuation in minutes. Now, this is not gonna like, accentuate the person. But the problem here is that the cranial vault is a closed cavity. It cannot expand like the soft tissues elsewhere. So even if there is a little bit of bleed, it would going to lead to pressure. So what would happen if the bones can't give way? Then something has to give way, and that is brain. Brain is a very soft structure, so it would give way. So there would be pressure on the brain. Brain would be shifted to one side. Why? Because there is no other way. Bones cannot give way. So the brain would give way. And when the brain would give way, it's going to lead to trouble. 100%. Trust me on this one. So what happens when there is pressure on the brain? That leads to what we call as a midline shift. And how do we know about midline shift? Remember, the buzzword here is symmetry. If you're looking at the CT scan, there is a symmetry on both sides. And that's why I've given the image of Denzel Washington. Denzel Washington has got a very symmetrical, like beautiful face. Same goes for CT scans also. Should be symmetry. If you draw a line going through the two cerebral hemispheres, they should be like, images of one another. Beautiful symmetry. One should be matching the other side. But if you see one side is not matching the other side, if there is an asymmetry, there is something wrong. Could be anything. There's some pressure effects. Could be bleed, could be tumor, anything. Sometimes it's not easy to say, oh, well, this is definitely because of bleed. Might be because of a tumor somewhere, or because of vasogenic edema, because of stroke, or because of anything. But simply means that there's trouble. There is some form of pressure. So if you draw, like for example, if you see this image, so we have drawn a line going through the center of the two cerebral cortex, and if you see here, the anterior horn of the lateral ventricle, so it's not symmetrical. It's more visible on the patient's right side as compared to the left side. Same goes for the posterior horns and other things. So it simply means that there has been pressure. Why? Because ventricles are asymmetric. There is asymmetry, and asymmetry means that the midline has been shifted to the opposite side. So in this case, the midline should be like passing through here. But what has happened? It's more visible, so things have been pushed to the other side. So normally it should be symmetrical, but something isn't right because things have moved from one side to the other side because of the pressure, and this pressure could be because of the bleed. It could be an extradural bleed, it could be subdural bleed, it could be subarachnoid bleed, it could be intracerebral bleed, it could be a tumor as well. Sometimes it is visible, sometimes it's not visible. Again, but simply means if there's an asymmetry, you can say that there is pressure effect. In most of the cases, it should be because of bleeds, but could be other reasons as well, as I told you earlier, tumors. Now, in this case, if you see there is a midline shift, if you draw a line, you can see that things are more visible on one side as compared to the other side. So there has been some pressure effects on this left side, which is pushing it towards the right side. Now, this could be anything. Now, here you can't see any clear-cut or whitish, hyper intense shadow, which would tell you, well, this is either a extradural bleed or a subdural bleed or a subarachnoid bleed. It's not, but you can see that there has been a midline shift. Why? Because sometimes the blood does not appear white. If there's a little bit of time, it would appear as isodense. Isodense means it is of the same shade as is the brain tissue. So you're not able to pick it up. Now here, if you see, we have compared these images side by side with an MRI. So an MRI can clearly show you a crescentic shadow, which basically crescentic means subdural bleed, a subdural hematoma. So there was a subdural hematoma, but then here you can't see it, okay, because I have superimposed with the with the yellow lines over here. But basically, it's so isodense that on the CT scan you are not able to pick it up. But at least you know that there is a midline shift. So again, you have to correlate with the history. In this particular case, you probably would have to go for an MRI to pick it up. But at least you know that there is something wrong. Why? This is known as the mass effect. This is known as the pressure effect. So one side is pressing on the other side, leading to midline shift. Remember, so the side which is being compressed, that would appear smaller as compared to the side which is causing the pressure. So the causing the pressure would be seem to be a bit bigger as compared to the side which is being compressed, which would be smaller. So the problem would be on that side which is appearing bigger, because that's the side which is from where the pressure is coming. Okay. Okay. Now moving on to talking about where else you can find that there are pressure effects because of the bleeds. Bleeds can sometimes be at the base of the skull, and that is usually a bit difficult to pick up because CT, when you're doing CT of the brain, these areas, there are a lot of bones, okay, and that would appear up as white shadow. So again, as I told you, MRI would be a better, diagnostic modality if you are going for infratentorial lesions or bleeds or things like. But nevertheless, I mean, there are a few tricks by which you can even read it on a CT scan. So there are two types of mass effects. Like one is the subfalcine herniation, and the other is the subtentorial herniation. The subfalcine means that between the falx cerebri, the pressure would shift the part of the brain to the other side. And I just discussed it with you that usually when you are talking about subfalcine midline shifts or subfalcine herniation, that always appears as midline shift. So remember, a midline shift, if you see on CT brain, is equivalent to a subfalcine herniation. Is that clear? And it could be because of bleed, it could be because of pressure effects, because of tumor, vasogenic edema, anything. Okay, going down, there are two types of cisterns, okay, that we usually look at. So one are the suprastellar cisterns, which you can see in this image over here, which appear in the form of a star or a pentagon. And the other one are the what we call as the quadrigeminal plate cisterns, which basically appear as in the form of an evil smiley. So if you look at this image, and probably I've overdrawn over here, so you can see that this is probably the eyes, okay, because these are the inferior parts of the interior horns, and then you can see here, okay, so in the form of an evil smiley. So that normal shape of evil smiley basically means that this is normal quadrigeminal plate cisterns at the lower part of the brain, that is the infratentorial region. And similarly, you should also look at the suprastellar cistern, which should be in the form of a pentagon. So normally, again, to summarize it, you should see a pentagon and you should see an evil smiley in a normal CT of the brain. You are looking basically for infratentorial herniation. So if you see a pentagon or if you see an evil smiley, there is no infratentorial herniation. It means there are no mass effects in this region. Clear? Okay. If you see that this pentagon becomes a triangle or is distorted, like for example, this is a normal pentagon, and in this image you can see that it is being changed into a triangle. Here you can see it is probably into a rhomboid space shape or something. That simply means that there are mass effects. Mass effects mean that there is infratentorial herniation. Similarly, if this evil smile gets a Bell's palsy, normally, as I told you, you should see and like a symmetrical, this evil smile as far as the quadrigeminal system is concerned. So if that disappears and looks like there is smile on one side but nothing on the other side, well, again, there is some form of infratentorial herniation because of pressure effects. That pressure effect again could be because of the bleed somewhere. It could be because of vasogenic edema. It could be because of tumors as well. And again, as I said, sometimes CT brain has to be followed by MRI or different other forms of MRIs like MR angiography or things like that to further delineate the actual pathology causing these things. But nevertheless, CT brain is always a very good starter, a very good starting investigation when you are suspecting bleeds and strokes. So remember, in adult medicine, usually stroke and infarctions, like all these things are bleeds because of aneurysms or blood pressure, high blood pressure, things like that are quite common. In children, well, some they can get stroke because of different types of pathologies, especially if they've got like coagulative disorders or they've got anatomical, vascular problems, or they have got tumors. So that can cause bleeds, that can cause stroke, that can cause infarct. So pediatrician will be more interested from that particular point of angle. But nevertheless, the principles remain the same. So whether you are an adult physician, whether you are a pediatrician, well, you still need to focus on these things. Okay, fine. Now the other thing is bleeds are one thing. Many times, especially my friends who are from the adult medicine, like as compared, if you take different forms of stroke, hemorrhagic stroke and cerebral infarction, infarction is more common as compared to the hemorrhage counterpart. So in infarction, usually because there is no bleed, basically, there is sort of like occlusion of the blood supply leading to death of that particular area. So what would that lead to? That would lead to vasogenic edema. That would lead to vasogenic edema, and that edema can itself cause pressure effects leading to midline shift. But there is another one thing that can help you. Normally, I mean, if you look on normal CT scan, there is some form of gray and white matter differentiation. Gray and white matter differentiation, and it is in the form of, like, finger like projections of the white matter going into the uh, outer areas of cerebral cortex. So it's just like the the tangles of an octopus radiating bilaterally into the subcortex. So you should see. So this is a normal differentiation, like normally the octopus arms would like. But if you see, let me go on to the next slide. So if you see that that differentiation is lost, if you can't see clearly on one side or on both sides that these arms of the octopus are not very clear, that white gray matter differentiation is lost. We call the gray and white matter difference because it feels like a smeared one. Like, for example, I told you that normally you can very clearly delineate between the gray areas and the more darker areas. As you can see, these are the projections, like the tentacles of an octopus. So very clear demarcation. But if it gets smeared, like here, you can see the sort of demarcation. But if that demarcation becomes very fuzzy, that becomes like smeared, as if somebody has smeared painted, you don't know where it is. Um, you don't see that exact boundary. Obviously, you're seeing that it's gradually changing shades from more darker to the more lighter form of gray, but you can't see that very distinctive edge. That simply means that there is some form of edema, vasogenic edema. That vasogenic edema could be because of the dying blood vessel. That dying blood vessels could be because of cerebral infarction. It could be sometimes, because of a tumor, because when the tumor cells are proliferating, the adjacent cells, they die out, and when they die out, that leads to edema, necrosis edema. We call it vasogenic edema, and then there is a lot of swelling in that area, and that swelling would lead to pressure effects on the opposite side. So remember, if you see that there in adult medicine, if you see that there is loss of demarcation of the gray white matter border, probably you are looking at an infarct. Could be other reasons as well, vasogenic edema because of tumors, other things, but like common things come first. And the same principle is applied in pediatric medicine as well. So this, in a nutshell, was how to read CT of the brain easily and for common conditions. I told you fractures are easy to pick them up because in that particular case, you will be looking at the whitish bony window, and usually if you see at the 3D reconstruction, you can usually pick it up, especially in the pediatric medicine. But nevertheless, we also do these CT scans to see if there is a bleed on the surface of the brain in the form of extradural, subdural, subarachnoid, intracranial, or infarction. So I hope this small lecture gives you the insights into how you can easily read the CT brain to pick up these conditions. Now, if you still have got any questions regarding how to interpret CT brain for these conditions or for any other purposes, please put your question down in the comment section below, and I will try my level best to answer as soon as possible. And before closing up today's session, for those of you who have joined me for the first time on my channel, please do subscribe, as it helps to maintain the channel. And please share this video with your friends, and don't forget to press the bell so that you are always on board with me whenever I upload a new lecture. So have a very good weekend. Take care, stay blessed, and stay safe. Bye-bye.